Hello, you are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, today I talk to you about what may be the indication to remove, the nail. I'm talking about the nail plates. Okay, I'm talking importantly. I'm talking about the fingernail. And then of course which nerves we have to anesthetize, yes, before we remove such nail plates, so that the procedure becomes pain free, so to speak. And so without wasting my time, let's set the ball rolling. Now, first of all, clinically there may be the indication to remove someone's fingernail. Okay, and one of such reasons is something that we call ingrowing nail. And clinically, ingrowing nail, we call it onychocryptosis. Okay, so that it gets hidden, of course, penetrating the soft tissues of the nail, and it becomes very painful. And in such a case, there may be the indication, if it's so severe, the pain is such that it is so excruciating, there may be the indication to remove such nail. Not only that, something that we call onychocryptosis. And in such a situation, yes, the nail is deformed in such a way that it is curved, yes, penetrating these soft tissues. It's also often associated with that kind of pain. And my friends, there could be that kind of fungal infection to this kind of nail that we are talking about, something we call onychomycosis. And my friends, something that oftentimes, yes, even in the local setting, yes, the women who often use soap, of course, other washing, detergents, okay, and sometimes it could be some kind of infection, okay, say that there will be inflammation to, of course, something we call the nail folds, okay, which of course becomes very painful. In the layman's term we call it whitlow. Okay, such a thing is something we call chronic recurrent, something we call paronychia. Okay, so these things, okay, are some of the indications, okay, for the removal of the nail. And my friends, importantly, today's meeting we want to understand the branch of which nerve. Yes, last week or last 2 weeks and 3 weeks ago, we've discussed, of course, these long nerves, okay, clinically, how we can, diagnose such injuries, and of course, how we can also test them. But my friends, today, there are some important branches of these nerves, which of course will supply the nail base. And that is why, yes, we are doing this meeting. So that, of course, clinically, if we are asked to go and do a particular procedure, you know which branch of a nerve we are going to anesthetize, so that you go through the procedure in a pain-free manner, and becomes uneventful also. Now, if you understand, if you look at my palm, one thing we understand is that we've divided it into something we call, yes, lateral 3.5 aspects, and then you have what we call medial 1.5 aspects. Now, lateral in the sense that wherever the thumb is, that's towards the lateral aspect, and wherever the little finger, the pinky is, that's towards the medial aspect. So what we have over here is that, for instance, if I use this marker to demonstrate something to you, what we see is that this area, okay, all the way from here, okay, so this area is actually the lateral 3.5 aspects of what we call the hand, okay, together with, of course, the fingers, the palmar aspect, the volar aspect. Now, if I go to the opposite as where towards the little finger is, this time becomes the medial 1.5. 1.5 in the sense that this is what we call the pinky, and then of course medial half of what we call the ring finger. Okay, now the innervation as far as the palmar and the digital areas are concerned, yes, they are different. And what do I mean by that? What I mean is that if I look at this lateral 3.5 aspect, it is taken care of by what we call the median nerve. Yes, no doubt about that this area will be taken care of by, of course, the palmar cutaneous branch of the median nerve, and of course these areas of the digits, okay, the 3.5, lateral 3.5, will be taken care of by the digital, cutaneous branch of what we call the median nerve. No doubts about that, but the point is that they are branches, both branches of the median nerve. Now, not only, apart from that, if you go to that of the lateral, medial 1.5 aspect of the palm, together with the digital area, then what we see is that it's rather be taken care of by what we call a branch of what we call the ulnar nerve. This time, ulnar nerve. Okay, so that is one thing that we understand. Okay, now here usually there isn't much of a problem over here, so it tells me that the first space over here in this digital area, where space that we find over here, the second one, and of course the third one will also be taken care of by, of course, the median nerve, branches of the median nerve. But if I look at this case, the fourth web space that we find over here, this time around it will be taken care of by, of course, a branch of the ulnar nerve. That's one thing I want you to understand. Now, importantly, today's meeting we are talking about what we call the nail base. Okay, if you are going to remove these nail plates over here, okay, which branches of which nerve we have to anesthetize. Now, if I look at this time the dorsal aspect over here, this time is a little bit different. Now, in the region of the dorsal aspect, what we understand is that the same way we can divide it. Okay, let me use a different marker. Okay, we can divide it into the same way. This time again we can divide it into what we call the medial 1.5 aspect and then the lateral 3.5 aspect, okay, of the digital, and then of course the hand area. Of course, I'm talking about the dorsal aspect of the hand. Okay, that is what we see of the palm actually. Now, some authors and of course experimentally has been proven that some other individuals, as far as the palm, okay, of the hand, the dorsal aspect of it is concerned, is rather 2.5 and of course 2.5, equal contribution, 1/2, 1/2, 2.5, 2.5. But when it gets to the digital aspect, which of course the main purpose for this meeting is rather of course medial 1.5, just like what we find in the case of the palmar aspect, and of course the lateral 3.5, just like what we described in the case of the palmar aspect. Now, what do I mean by this? Now, what it tells me is that now in the case of the dorsal aspect, not the volar, again, also the dorsal aspect of the medial 1.5 aspects of the digits is also taken care of by, of course, a branch of the ulnar nerve. So, my friends, what I want you to understand right now is that both the palmar or the volar aspects and of course the dorsal aspects of the medial 1.5 of the fingers and of course the hand also will be taken care of by, of course, the the ulnar nerve. Now, what it tells me is that it's that same area that we have the nail base. So the nail base of the little finger, then it means that I have to anesthetize the cutaneous branch, okay, digital branch of what we call ulnar nerve, so that I can remove, if this one is infected, and we have to remove it of what we call the little finger. Okay, now if it is that of the middle finger, you realize that it is shared by 2 nerves. So, but right at this time around, what I want you to know is that if it's the medial 1.5 aspect of the nail that we are talking about of the ring finger, then of course the same branch of the ulnar nerve will have to be taken care of. We have to undergo that kind of anesthesia. We have to anesthetize it. Now, my friends, how about the lateral 3.5 aspect of the digit? I told you that in the case of the palmar aspect, we said that also, of course, by the median nerve. Now, when you get to the dorsal aspect of the hand, okay, over here, 3.5, it is rather taken care of by this time around the radial nerve, excluding the nail base. So the nail base, and I'll actually begin from the level. Now, look at this area, the level of what we call the middle phalanx, okay, and of course the distal phalanx. Now, it is the distal phalanges, okay, and of course the phalanx of what we call the thumb, okay, the distal phalanx of that of the thumb, which of course will be by what we call the median nerve. So please understand, the median nerve does not only supply the palmar aspect or the volar aspect, but also the dorsal aspect. Actually, which portion? I'm talking about the nail base. And when talking about the nail base, I'm talking about from the distal, the middle phalanges, and of course the distal phalanges of the lateral, 3.5 aspects of the fingers. And so, for instance, if we ask the question that if someone is going to undergo the removal of the nail plates, okay, of the ring finger, then which nerve branch will have to be anesthetized? And my friends, your answer you are going to give is that it's going to be a branch. I'm actually talking about the digital branch of who? The median nerve. Yes, that of the thumb too, the same thing, the median nerve. That of the middle finger, the medial nerve. But my friends, in the case of the ring finger, we have to anesthetize both, digital branches of the ulnar nerve and that of the median nerve. So my friends, we have to understand these things so that of course we know the clinical situation, which of course we are often confronted with in our examination. I believe you've got the explanation right, and whichever question that you find regarding the cutaneous elevation of the hand, okay, of the digits, of the palmar or dorsal areas, yes, we won't have any issue with that. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.